Peripheral neuropathy is a common condition I see every day in my office. It's also one of the most frustrating conditions to have and to treat. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. Peripheral neuropathy is nerve damage that affects the extremities, both the hands and feet. In today's video, I'm going to discuss how the Remy Class 4 laser is offering new hope for patients dealing with this challenging condition. But before I do, let others know about these videos. Please like, comment, hit the subscribe button, and share on social media. This will help others find the information they need. If you're dealing with peripheral neuropathy, this is all going to sound familiar to you. The burning sensation in your feet that keeps you awake at night. The numbness that makes it feel like you're walking on cotton. The tingling that never seems to go away. You've probably been told there's no cure, that you'll just have to manage the symptoms with medications like gabapentin or Lyrica. Maybe you've experienced the side effects of these medications, the brain fog, the dizziness, the fatigue. What if I told you there's a treatment that addresses the underlying nerve damage itself, not just the symptoms? A treatment that's helping many of my patients reduce their pain and actually feel their feet again. That's what we're going to discuss today. Let's start with the basics. What exactly is peripheral neuropathy? Peripheral neuropathy is nerve damage that affects the extremities. The reason it usually starts in the toes is simple. Your toes are the farthest point from your brain. Your brain receives impulses from the nerves and translate that into sensations. From your feet all the way to your brain, it's a long way to go, and there are plenty of opportunities for things to go wrong. There are many cases of peripheral neuropathy, too many to count, and that's part of the problem with treating it. The most common causes include diabetes, aging, vitamin deficiencies, chemotherapy, alcoholism, smoking, and some medications. Ironically, some medications used to treat peripheral neuropathy can also cause it. The symptoms come in different forms. Some people feel a numb sensation, others feel burning and tingling to varying degrees. Some feel pain so intense that it feels like the feet are on fire. It's important to differentiate nerve pain from other causes of pain. If your feet are hurting when you're standing and walking, that's usually musculoskeletal pain like tendinitis. If the pain primarily occurs when you're off your feet, such as when you're laying in bed at night, it's more likely to be nerve pain. Here's the challenge. In some cases, peripheral neuropathy is caused by the aging process. While we can help calm the symptoms, we don't have a fountain of youth. If a nerve is completely damaged, there's no way for it to regenerate. If we could regenerate nerves, there would be no one who's paralyzed. But here's what's encouraging. Many cases of neuropathy involves nerves that are damaged but not completely destroyed. These nerves can potentially be helped to function better. This is where the Remy Class 4 laser comes in, and the science behind how it helps neuropathy is fascinating. The process is called photobiomodulation. The laser delivers specific wavelengths of light, 810 and 980 nanometers, that penetrate deep into your tissues and stimulate cellular activity at the mitochondrial level. Think of your nerve cells like tiny batteries. When you have neuropathy, these cellular batteries are running low on energy. They can't produce ATP, that's the energy currency of cells. They need to function properly. The laser energy literally recharges these cellular batteries. It stimulates the mitochondria to produce more ATP, which gives the nerve cells the energy they need to function better and potentially repair themselves. But it doesn't stop there. The laser also increases blood flow to the nerve endings. This is crucial because nerve pain is often linked to circulation problems. When there's not enough blood flow to the nerves, they're deprived of oxygen and nutrients, which increases pain and dysfunction. The laser also reduces inflammation around the nerves. Chronic inflammation creates an environment that's hostile to nerve function and repair. By reducing inflammatory cytokines and oxidative stress, we're creating a better environment for nerve healing. Here's what makes this particularly relevant for diabetic neuropathy. Diabetes affects the small blood vessels that supplies the nerves. This is called microangiopathy. The laser helps dilate these small blood vessels and improve circulation to the nerve tissue. So what does laser treatment for neuropathy actually look like? The treatment itself is completely comfortable. You'll lie on the treatment table and I'll systematically treat your feet and lower legs with the laser. You'll feel a gentle warming sensation. Many patients find it quite relaxing. For neuropathy, I typically treat the entire foot, from the toes up to the ankle, and sometimes in the lower leg. This comprehensive approach addresses the nerve pathways and ensures that we're reaching all the affected areas. Each treatment section takes about 15 to 20 minutes. There's no downtime. You can immediately return to your normal activities. The treatment protocol for neuropathy is different from other conditions. Because nerve regeneration is slow, we need more intense approach initially. I typically recommend starting with treatments 2 to 3 times per week for the first few weeks, then gradually spacing them out as we see improvement. Now let's talk about realistic expectations. Nerve regeneration and repair takes time. You're not going to see overnight results like you might with pain conditions like plantar fasciitis. Different symptoms respond at different rates. Burning and tingling sensations often improve before numbness. This makes sense because burning indicates that nerves are still functioning, just not properly. Numbness suggests more significant nerve damage, which takes longer to improve. Most patients start noticing some improvement after 6 to 8 treatments, but significant improvement typically takes 12 to 18 treatments or more. The key is consistency and patience. It also is important to understand that laser therapy works best when the underlying cause is addressed. If you have diabetic neuropathy, getting your blood sugar under control is essential. If your neuropathy is caused by vitamin deficiencies, those need to be corrected. Let's compare laser therapy to medications typically prescribed for neuropathy. Medications like gabapentin and Lyrica work by affecting how your brain processes pain signals. They don't actually heal the damaged nerves, they just change how you perceive the pain. These medications can be effective for some patients, but they come with significant side effects. Brain fog, dizziness, weight gain, and sedation are common complaints. Many patients tell me the side effects are almost as bothersome as the neuropathy itself. Laser therapy takes a completely different approach. Instead of masking symptoms, we're actually working to improve nerve function at the cellular level. The side effect profile is dramatically different. Laser therapy has essentially no side effects when used properly. You don't experience brain fog or dizziness. You can drive immediately after the treatment. You can continue all your normal activities. Another advantage is that laser therapy can be used alongside your existing medication. If you're currently taking gabapentin or Lyrica and getting some benefit, we don't need to stop those medications to start laser therapy. Many patients find that as their nerve function improves with laser therapy, they can gradually reduce the medication doses under their doctor's supervision. Laser therapy is also safe for diabetic patients. There's no drug interactions to worry about, and it doesn't affect blood sugar levels. Laser therapy can be beneficial for many types of neuropathy, but it's most effective when there's still some nerve functioning remaining. It's particularly helpful for diabetic neuropathy, chemotherapy-induced neuropathy, and idiopathic neuropathy. That's neuropathy where we can't identify a specific cause. The treatment is safe for patients of all ages and can be used even if you have other health conditions. Because it's applied locally to the feet and legs, it doesn't affect the other body systems. Patients who are good candidates include those who want to avoid or reduce their reliance on medications, those who haven't responded well to traditional treatments, or those looking for a treatment that addresses the underlying nerve damage rather than just masking symptoms. I want to be clear about what laser therapy can do and what it can't do for neuropathy. Laser therapy is not a cure for neuropathy. If you have significant nerve damage, we might be able to improve your symptoms and slow the progression, but we're not going to restore completely normal sensation. The goal is meaningful improvement in your quality of life. This might mean sleeping better because you're not waking up with burning feet. It might mean that you're able to feel your feet better when you walk, improving your balance and confidence. Prevention and lifestyle factors remain important. If you have diabetes, maintaining good blood sugar control is crucial. Taking care of your feet, wearing proper shoes, and avoiding injury are all important regardless of what treatment you're receiving. Some patients may need maintenance treatments to sustain their improvement, especially if they have ongoing risk factors. If you're dealing with peripheral neuropathy and are feeling frustrated with your current treatment options, I want you to know that you have alternatives. Laser therapy represents a different approach, one that works to improve nerve function rather than just masking symptoms. While it's not a miracle cure, It helps many patients achieve meaningful improvement in their quality of life. Thanks for taking the time to watch this video. Please take a moment to like, comment, and share on social media. Be sure to hit subscribe so you won't miss another video. If you're suffering with peripheral neuropathy and you want to explore whether laser therapy might be right for you, contact us at the office. We'll evaluate your specific situation and discuss all your treatment options. The link to request an appointment is in the description. Thanks so much for watching, and have a great day.